Okay, you're good to go.
Awesome. We have a good group here today. Thank you all for joining. Welcome to our first Quality Cafe. Our plan today is for me to present the program for about 20-25 minutes and then have time for discussion and questions. And then with any remaining time, we'll open the floor for anything, any questions or issues you all have and want to discuss for that. Going to be pretty informal, so put a note, question in chat, unmute, and put your, ask your question as we move along with that. All right, so I wanted to start with just getting us all on the same page for what is a QAPI plan. The QAPI plan will guide your organization's performance improvement efforts. Your plan is intended to assist you in achieving what you have identified as the purpose, guiding principles, and scope for your QAPI program. It's intended to be a living document that you will continue to refine and revisit, not just annually. This plan should reflect input from caregivers representing all roles and disciplines within your organization and should include all departments and services in your facility, including services provided by contract. Here's some definitions. Just wanted to make sure everyone's on the same page and understood what these all meant. COPs, or conditions of participation. CMS developed the conditions of participation for healthcare organizations that the conditions of participations are what healthcare organizations must meet in order to begin and continue participating in the Medicare and Medicaid programs. Interpretive guidelines are served to interpret and clarify the conditions of participation. The interpretive guidelines merely define or explain the relevant statute and regulations and do not impose any requirements that are not already set in the statute. They're used by the surveyors during the survey process. QSO memos are quality and safety oversight memorandas. They're how CMS offers guidance, clarifications, and instructions to state survey agencies and CMS locations. So QA, there's actually two of them. QA can be quality assessment, which is an evaluation of a process and the outcomes of a process to determine if a defined standard of quality is being achieved. QA is in quality assurance, is the organizational structure, processes, and procedures designed to ensure that care practices are consistently applied and the facility meets or exceeds an expected standard of quality. QAA is kind of the old term, quality assessment and assurance. It's a management process that is ongoing, multi-level, and facility-wide. It encompasses all facility departments. And QAPI is the quality assurance and performance improvement. QAPI is the coordinated application of quality assurance and performance improvement. QAPI takes a systemic, comprehensive, and data-driven approach to maintaining, improving safety and quality. I know that's a little dry, but I just want to get everyone on the same page for that. So here's just a little timeline. The QAPI requirements were developed 2 decades ago, actually 2003. CMS updated the hospital conditions of participation to include QAPI program 5 elements, and we'll talk about those a little bit more. The quality assurance and performance improvement was passed by Congress in March of 2010 as part of the Affordable Care Act. This related specifically to nursing homes. This new provision significantly expanded the level and scope of required QAPI activities to ensure that facilities continually identify and correct quality deficiency, as well as sustain performance improvement in their facilities. Medicare and Medicaid programs, reform of requirements for long-term care facilities was implemented and published October 4th of 2016. And this outlined an updated to the QAPI program in a 3-phased implementation plan. If many of you were around for that, it was 3 whole years. Every year there was something new you had to have. The full implementation was November 28th of 2019. 2020, they brought the hospital standards up to meet the long-term care standards, and they published updated hospital QAPI standards. With the pandemic, though, these interpretive guidelines for the regulations were not implemented or sent out until March of 2023. CMS issued the new interpretive guidelines in a QSO memo in March with information and directions for surveyors on assessing a hospital's QAPI program. So this information, 98% of the information in the QAPI program is not new. It's been around since 2003. They've just tightened how they're it's surveying and expecting us to comply with it. All right. So now on to the meat of it. Why have a written QAPI plan? It's for long-term care centers. The FTAG 865 addresses the QAPI program and specifically states the facility will need to maintain documentation and be able to demonstrate evidence of the program, that the program meets CMS requirements. So you have to have documentation. The regulation states that you'll be required to present the QAPI plan to state survey agencies, and the facility required to present the QAPI plan to state survey agencies or federal surveyors during the annual certification visit. So they don't say you have to have a written plan, but they say you have to be able to present it. So you kind of have to have a written plan. For hospitals, CMS requires that hospitals must maintain and demonstrate evidence of its QAPI program for review by CMS. While not specifically called out in regulation, the interpretive guidelines to surveyors indicate reviewing the facility's written QAPI plan. And furthermore, the QAPI plan is often requested by CMS for surveyors upon entrance to the facility. I put the hospital condition participation and the critical access hospital number there, so you'd have it for your reference. The Joint Commission standard, this one was updated in January of 2022, states that the organization has a written plan that describes quality measurement and performance improvement activities. These are the QAPI plan elements. CMS does not require any specific QAPI plan or template, but this template was initially developed for nursing homes, but it also matches the requirements for hospitals in the latest with the latest regulations. Here's a link so you can follow along. So let me just drop this link in the chat for you. Highlight it unless Debbie's got it before I got it. Good for me to.
Do you want me to do it or you got it?
I just got it.
Okay.
Feel free to open that and kind of follow along. That way you can kind of see that. There are 5 core QAPI elements for any QAPI program, and those are design, scope, governance and leadership, feedback, data systems, performance improvement projects, and systemic analysis. Those 5 are included in here with 4 more for clarity. These 9 are pretty much required for long-term care, and most long-term care QAPI plans include these 9, and having these 9 in your hospital plan will just make you that much beefier in your plan. We'll review each section individually by clarifying the definition, share any updates required by the new rulings, and we'll show some examples from our peer facilities. I wanted to thank Samuel Simmons, Fairbanks, and Ketchikan for sharing their QAPI plans for us to use during this presentation. Yay. All right, so the first element is goals. The goals seems like an easy one. You basically are just going to define what the overall goals of your QAPI program is. So one suggestion is to include language from your vision statement, vision, mission, guiding principles for your facility. It's not required, but it may be helpful in describing how QAPI is integrated into your entire organization. Describe how your QAPI plan is consistent with and framed on principles that guide your organization. Provide as much description as possible to show the connections between your mission, vision, quality principles, and the quality improvement culture within your organization. This is a nice simple one from Samuel Simmons, just clearly putting out what their goal and purpose is of their program. The next element is scope. This section describes the scope of how your QAPI is integrated across and into the full range of care and services of your organization. Each of these service areas will be involved in the organization's overall QAPI plan and involves in QAPI activities. You can list your services and departments, describe how your QAPI plan will be addressed, any key issues. In this example from Fairbanks, the services are listed as well as calling out the long-term care, the Denali Center, and clinical as being in scope for the plan. We'll talk about it later, but it is totally fine to have one plan that covers all of your facilities. Governance. These are the specific hospital conditions of participation related to the governing body and QAPI. These standards were mirrored in the CAH conditions of participation as well. These conditions of participation are not new. Actually, were put out in 2003, so they've been around for 20 years. But the March 2020 QSO memo really told surveyors that they want to ensure that the governing body is involved. While executive leaders and the governing body are not expected to be involved in the day-to-day operations of your quality program, they should be actively engaged in the oversight and periodically review of the program. The governing body periodic review should ensure a plan is developed to implement and maintain the QAPI program, approve the number and types of annual projects based on the complexity and scope of the services provided to your facility, specify the frequency and detail of data collection, as well as review processes of QAPI projects and evaluate the effectiveness of the implemented improvement actions. The governing body should be provided with enough information as necessary regarding the facility's QAPI program data collection processes so that they can make these determinations and approvals of the program. I'm going to put a little plug in for our next quality cafe because we're going to talk about talking to the governing body, talking to your board. So we have an example from Ketchikan's QAPI plan. She showed a kind of an org chart type to help visualize the structure of the reporting. And she also further defined each level's role in the process. I really like how she had it lined up. The next plan element is data. Your organization must effectively identify, collect, and use data and information from all departments. Choose data sources your organization will use to develop and monitor performance indicators that will track your ongoing performance. The red shows the updated condition of participation related to QAPI program data. The program must incorporate quality indicator data, including patient care data and other relevant data. And then they specifically call out such as data submitted to or received from Medicare quality reporting and quality performance programs, including but not limited to the data related to hospital readmissions and hospital acquired conditions. So they're saying you should do that. So make sure those things are included in your program. Of note, the critical access hospital conditions of participation have not been updated to include this requirement. I say yet, but I'm assuming that'll be coming soon. Here's a couple of examples of the data section of the QAPI plan where they describe the purpose, methods, processes, and what is done with the data. You will get a copy of these slides, so you can refer to that later. Performance improvement projects is the next section. You need to describe the overall how and why your organization will conduct performance improvement projects to improve care and services at your facility. Describe how the PIPs are identified and describe criteria for prioritizing and selecting those performance improvement projects. Show your methodology for QAPI, whether it's PDSA, lean, whatever that is. Charts are always great. Systemic analysis is the next plan element that's required. Systemic analysis involves identifying the underlying causes of problems and addressing them in an organized fashion. To do so requires a thorough investigation of events, processes, and systems to uncover the root cause of issues and prevent their reoccurrence. Systemic action may also mean changes to policies, procedures, trainings, or the physical environment. The conditions of participation did not change for this section, but the interpretive guidance did. Highlighted in red, the interpretive guidance the surveyors state after the systemic analysis of the error or adverse event has led to the identification of the cause of the event, hospitals should develop and implement preventative actions to improve the quality and safety associated with the event or the error. So they're really looking to make sure you're looking at what has happened and have a process to make sure it doesn't reoccur and it fixes it across your whole facility. Here's an example for how systemic analysis would be implemented in their facility using proactive risk assessments and ongoing monitoring of interventions. Communications is the next section. The communication section outlines the audience's format and frequency for QAPI communications. This example shows a broad overview of the plan. Feel free to be specific as you wish in this section, but understand you'll be held to what you put in your plan to surveyors. So I always think less is more in what you're writing in your plan. And if you choose to, if you're choose to be less general, more specific, then you'll have to make sure you do that every time. Evaluation of the plan. Here are two examples of program evaluation. In the QAPI plan, you should outline how often the plan is reviewed and by whom. The conditions of participation indicate the evaluation is done as needed and at least annually. The establishment of the plan is basically just putting a date on it. It's simply dating your document and showing revisions and applicable dates. In these examples, the approvals are also documented in the plan. I wanted to note that the conditions of participation allow for a unified QAPI program across the hospital system. This standard helps clarify how to address a system governing body over multiple facilities. So speaking of like Providence as an example, they can have one QAPI plan to cover all of their facilities. As long as you incorporate the complexities or the uniqueness of each facility somehow in that plan. The survey process. So in 2022, quality assessment and performance improvement, QAPI, is the third most frequent cited conditions of participation across the nation. I had some conversations with our state surveyors, and they indicated that in reviewing the QAPI program, they would not really look at your identified issues. So you might identify issues in your plan, your priorities, but they want to look at how you identify those issues and how you process and created a plan of improvement for those issues. And has the plan been implemented and effective? Surveyors don't just read your plan and say it's good or not. Instead, they compare your plan against what they're finding in your facility. You will not get a QAPI citation without other areas of concern also being cited. I just, Matthew said this really well, so I just thought I'd quote him here, but it says, additionally, if you find an area of improvement and we find significant citations in that area during the survey, we will look to see if the QAPI program identified those areas as concerns and whether the plan was effective or not. The citations we find in said area of concern may lead us to determine that the QAPI plan was not effective, and then you would get a QAPI citation for that. Okay, that concludes my part of the presentation on how to write a QAPI plan and the required elements of that. So thank you for listening. I first wanted to see if any of our contributing facilities have anything to add. I don't know who is on, but if you are and you have anything to add about how you developed your QAPI plan or any issues you've had, feel free to pop it in there.
This is Jen Schuler from Foundation Health in Fairbanks. I was not involved in writing the program, but I see Dr. Ramirez is on. I don't know if she has anything to add because she was involved in writing it. I know I've been starting to look at it to get it updated for next year.
I'm sharing my screen.
Yeah, I'm on. I'm not sure. Yeah, Dr. Rose, I wasn't really prepared to speak to it. The only thing I would say is, here's my video. Hey guys.
Great, great to see you.
Yeah, no, I would say only that, and this was based off of past experience, that it's worth the time and energy to invest to write it comprehensively and simply and clearly as well as you can. Because then it just makes it easy, because then it's a roadmap for everything you do and you can kind of pull it out and it's a resource and you can go back to it and reference it, and it has clear guidance for a lot of things. And it also makes it easy to modify. So I think it takes a lot of time up front to try to do it right so it meets all the regulation requirements, but also is right for your organization. But I think it's really worthwhile investing that time up front and being thoughtful about things, because then you have like your little Bible or reference document that just comes into play repeatedly, rather than you're trying to figure out things on the fly here and there. So that's just kind of my 2 cents. So
Thank you for that. The 3 facilities said I could share them, so I'm going to drop them in the chat so you have take a minute for them to load. You can have those plans to actually look at when you're developing yours in your facility. Does anyone have any questions or comments? And feel free to turn your cameras on so we can see each other. Awesome. If you joined us a little bit late, just rename yourself with your facility so we know where you're all from. See, we have quite a few people on. This is quite awesome. From I see hospitals and nursing homes. This is great. All across the state. A few questions I have for the group is, maybe you can raise your hand if you have developed your QAPI plan and you think it's in your facility already. And just give us, how do you raise your hand in Zoom? I see Helen's got hers.
Or a little applause if you have.
Oh, there you go.
It looks like any type of hand gestures works.
Everyone gets to play with their Zoom this way. Jen's waving her hand. Awesome. Great. Anyone have any particular problems with their plan, or any other specific questions with the new I know I freaked out when the thing came out in March until I realized that they really weren't adding anything new. They were just mostly giving more interpretive guidelines to the surveyors on that.
Kristen.
Yeah, go ahead.
Hi,
Deb.
this is Deb Kelch from Bartlett. Hey,
Mhm.
I just wanted to say I really appreciate this presentation. I'm excited to get your slides, and thank you to the team for sharing your the 3 QAPI plans with the group. I've always thought we had like a really great QAPI plan written out. We go over it every year, kind of as a team. It's presented at the board level and kind of goes down from there. But I'm just excited to really take a close look and compare and make sure we do have all these pieces in there. I mean, I feel like we do, because I was going through it as you were speaking, Kristen, but I just appreciate having the other ones just to look and see how everyone else is doing it, to see how we can improve. And yeah, I think the only thing different for us, we specifically line out certain goals kind of at the organizational level at the end of our QAPI plan, like, or, and then the next year we share like whether or not it's been met. It's kind of a table style. So there's like at least 2 or 3 each year, right? Kind of board directed goals. And so we have those written out like as aim statements and like as a little metric, and then the evaluation will follow whether we've, kind of met that or not. But anyway, I guess more of a comment than a question, but just wanted to say this has been really great and I appreciate it.
Yeah, awesome. And I think a lot of facilities do put the put their quality, their data plan in a table format, and that's totally acceptable and whatever works for you and your facility. And I've also seen attachments with the evaluation, like there's our last evaluation and it's attached to the plan, so you can kind of see that in one place. Again, not required, but another kind of nice way of doing it.
This is Jen Schuler. I have a couple things. I think the first thing that I've kind of, as I've kind of moved into my role, that was a little challenging for me to kind of understand over time, but I mean, I have it now, obviously, but with us being joint commission, they really don't use the term QAPI all that much, and so then if you have the state come in, that's all they use. And so I think just making sure that in our organizations that people understand, what it is. I mean, because the terminology is different depending on, what you're using. So that's one thing. I think the other thing is too, that with, especially we have, home care and hospice, And when they come in and look at their projects, they actually want their process improvement projects to be completely approved by the board, where seems to be a little looser on the hospital side. And so I was wondering like how other facilities kind of, what their process is to kind of get approval on their projects.
Anyone have a response for Jen?
This is Dina. And so speaking from a hospital side, not home health or hospice, I don't get approval from the board, but I keep them updated. So we do presentations. I work with the various departments of the organization on their performance improvement projects, and they do presentations at QAPI, and then I share that information with the board when I do my presentations to the board.
Okay, thank you.
And it looks like in the interpretive guidelines that they're really looking for that board involvement and that they're aware and you know, they may want to look at those board minutes to make sure that they, you know, were given that presentation and they had the opportunity to ask questions and guide how it's done at your facility. So I think they're trying to move hospitals closer to what nursing homes has been required to the last few years.
Yeah, and I can say that that is something I encourage the board members when I speak to them to ask questions, and that I also encourage the department and division managers to talk about trends and performance improvement projects when they meet with board members as well, just to try to get more board involvement.
Thank you.
I've always been the kind that your data should be the one who dictates what kind of process improvements or action that need to be happen throughout your organization, whether I'm also speaking from a hospital perspective. So, and I've never had board approval on that, but just like Deanna was saying, but reports regularly go to the board to keep them apprised of what is happening, so they are aware and they can ask questions, and the data should be shared with them, and for that transparency, and they should be getting those regular updates. So that's typically, in my experience, how I've done things for at least over a decade.
Where I'll put the plug in for our next Quality Cafe, where we're going to talk about how to talk to your board. So, anyone have any other questions related to QAPI plans, or have anything they want to share related to that? I hope this was a good learning opportunity. I hope people learned something from that, and I hope next time more people are presenting other than myself, but I figured I'd get us started off. And I'm not the best presenter, but I appreciate everyone listening to that. So what I would like to open the floor up to just general quality questions. So if you want to drop off the call, you're welcome to. I'm going to ask Debbie to stop the recording, so we're not recording this part of the of it, and feel free to turn your camera